And welcome back to the Business Spotlight. It's your host, Patrick Dewar. My guest today is Dr. Mary Swift, and she is a cosmetic dentist. And when I say that, that's well, I don't even know if you would understand that much, because not many of us really go for cosmetic dentistry. A lot of insurance companies don't pay for that, but these things are amazing. The stuff that they're doing is cutting edge, and the type of client that really needs that is something that I really want to get into. And I know that as we move into this, I want to look at what you guys are doing that's so different, what you're doing to create the success you're having, Mary.
When I look at that question and try and look at my practice, I think I have a good grasp of what technology I should invest in to enhance the outcome for the patient. Okay. Dentists are famous for their toys, and their gadgets. And you can spend money on technology that you think is fun, but in the end, it really, didn't accomplish a lot for the patient. I've got in place digital software imaging that allows me to virtually straighten people's teeth on the computer and show them what the outcome could be. Wow. And that helps. If you can see, what it's going to look like, it makes that decision easier.
Well, because so many times people can't visualize it at all. They look at their mouth and they just go, "What can you visualize? Straight teeth?" And they go, "Nope."
Yeah, Invisalign is an amazing technology that's out there.
Invisalign.
Invisalign, invisible braces. It was developed initially for people that had braces when they were a teenager, but they didn't wear their retainers. Things kind of crowded a little bit, and Invisalign unraveled that. The technology has advanced in the last 10 years that it's been available, that now we can use it for a number of different situations.
When you say invisible braces, I can't see them.
Exactly.
How?
It's a set of little clear trays. They call them aligners. And those trays are worn. Each tray is worn for 2 weeks at a time. Each tray moves a little bit, then you put a new tray in, moves a little bit more, a little bit more. And because the old braces that used to be on, there was just something on the outside, and things kind of just had to swing around that. The technology, because this tray grasps the teeth, snugly, it's a more efficient movement. And, adults wouldn't, if I said to you, "Patrick, you could get your teeth straightened, but you're going to have to go down and get wires on your mouth," you'd go,
"Hot dog."
Yeah, I know. But if I said if I could do that and no one would see it,
that would be amazing.
It is amazing.
And I imagine you've got some really amazing stories throughout the years of people that have...
I do, and I'm actually a premier provider, which is a status that you are awarded after you've done a number of cases. So I'm actually tonight, as a matter of fact, going to a meeting where they've asked me to be there because I'm one of the few dentists in North Texas that instead of taking a goopy impression, I have a digital scanner. So it just goes right into the computer, and the trays are made from that computer image, so the accuracy is levels above the goopy impressions.
I just know of the goopy impressions.
So that's the cutting edge, yeah.
That's pretty unique. Are there any other toys that you have that are like that?
Lasers. It's Dallas Laser Dentistry, because I was an early fan of lasers. I use them in a lot of aesthetic cosmetic cases where you not only look at the teeth, but you look at the gums. It makes a difference. Now that I've said that, you're going to look at everybody's gums.
Oh, probably not, but I do tend to notice people's teeth, so yours are beautiful.
Well, there's a symmetry to the gums and the teeth, and there's some golden proportions and some rules that...
But how do lasers do that? I mean, I'm sitting there thinking,
well, they used to use
Star Trek or something, they're going to melt them. No.
It is melting. They used to use a scalpel, a blade, but lasers melt. And because of that, there's no, I hate to get into the blood and gore, there's no blood.
Oh, good.
There's no, it's just a way to very non-invasively, very easy, no discomfort, no aftercare problems, it's like trimming your cuticles, but it makes the biggest difference in a smile if you've got symmetrical gums and symmetrical teeth. If you've ever seen anybody where one tooth looks really long and the other one looks really short, lift that gum.
Of those, so. Well, that's good.
Yeah.
But so
So Invisalign
Invisalign, and then you've got the lasers.
Well, sometimes people ask me, like in a cosmetic case, can you fix this, doc? And well, if you really look closely, I can't fix that until I get your teeth where they should be. The reason it's broken is because something needs to change.
Right. There's more stress on there than you think there is.
Exactly. And so we have to make sure, for the long-term lasting of the restoration, it's like home improvements. The foundation has to be good. So it's a way of making the foundation good and then making the improvements on top of it.
So as we're coming up on this next segment, I want to go into who's the ideal client. So folks, you really want to be here for that, because many of you may be in a position where this is just perfect. Yes, I need to straighten the gums or straighten the teeth or literally brighten the smile. I know we were talking about brightening up some things. I know that I could use a little brightening. So with that, now I'm completely conscious about it. But
we can fix it.
Dallas Laser Dentistry can fix that. And this is Business Spotlight. The Business Spotlight is really about helping literally companies in the area tell their story and then getting it out into the marketplace. So with that, we'll be right back after this.